The following is an exclusive presentation of Optimum Local. It's Optimum or it's not.
When it comes to being at risk for concussions, boxers are just about unmatched. Yet they may be able to stay in the ring if they follow preventive measures, or get back into the ring more quickly if symptoms are recognized and successfully treated. A doctor and a championship boxer will share their experiences with boxing and concussions on this week's Health Talk. We're coming up next. Hi, I'm Dr. Eric Mazer. Today we're going to talk about concussions with Dr. Michael Schwartz. He's an internist with Soundview Medical Associates. He's also founder of the American Association of Professional Ringside Physicians, and he serves as the chief ringside physician for Mohegan Sun and Foxwood Resort Casino in Connecticut. Also with us is our first champion. It's Delvin Rodriguez. He's a professional boxer, and he is currently the reigning international and USBA light middleweight champion of the world. Welcome to both of you. I know Michael's been on before, Delvin. I'm starstruck to have you here.
Thank you, Eric.
Welcome to the show.
My pleasure.
I want to hear about your story because I think it represents sort of the American dream. You came here, well, you tell the story, just like we did before the show.
Well, yes, I came here when I was about 9 years old, coming from the Dominican Republic. Coming here, not knowing the language, not knowing the environment, not knowing the culture. So it was pretty tough. It was went to school. It was pretty much like an after-school program when I went to the gym with a couple of friends of mine. I just loved the competition, and it was a very good way to interact with other kids. Also, it took me around different tournaments.
So this was an afternoon boxing program at your local school?
Yeah, actually it was a PAL
Really?
program. Yeah, PAL gym in Denver, Connecticut, which, like I say, it took me I say about 3 months after I really started learning the boxing, the sport of boxing. I got really good at it. I love the competition, and it was a way for me to even travel as well. We traveled to New York many times. We traveled to Kansas City. Many places we went in the United States for tournaments and stuff like that. So as a kid, it was great, and it was a very good way.
And you were obviously very talented, so you were traveling as a I guess a protege.
Correct. And well, yeah, it took a long time. It took a while though before I really learned the sport and really got down the technique. But you could say that yes, I had talent at the time, and I was told by many people that knew the boxing world, where I really had an opportunity to make a good career out of it, and that's how pretty much it started out.
And I just want to dovetail to the medical issues. Michael, you're an internist. We've known each other for years, and you really got interested in boxing from a medical standpoint. So I'd like to ask you a little bit about how you got interested in it, but also the issue of the dangers perhaps to young children or younger children as they enter sports, boxing, football, where there is physical contact.
Sure. Like any young kid growing up, I watched Friday night fights with my dad, and loved watching Muhammad Ali and Joe Frazier in the old days. And when I was a resident at Norwalk Hospital, I was asked to work amateur boxing matches. And I was thrilled. I said, wow, I get to sit ringside at a fight. And while I was working...
Was that relatively new, or were there always doctors at the ringside?
Well, there's always been. If you watch the old shows, you'll see physician at ringside, and so it was always a doctor there. But I was asked to work professional at one of the amateur shows, and quickly recognized there was a lack of safety for these young men and women, and decided to kind of make that my life's goal, to protect these young athletes.
And Delvin, for you as a boxer and an elite boxer, what are your thoughts about having a doctor at ringside? Is this somebody that gets in the way of your ability to sort of go on, or do you view them as a friend and somebody working out there to protect you, or a little bit of both maybe is the real answer there?
That's a good question because, I got to say as a fighter, at the heat of the moment when you're fighting, you as a fighter, you don't give up. They have to kill me to be able to take me out of the ring, but we might get mad at the doctor if we get stopped at that moment because, like I said, if you're really a fighter, you don't want to get stopped. But later on, you really looking at it from a good point of view, like from a very smart point of view, is the best thing. We got to really thank the doctors, because they're the only one. They might be the only one that can, survive you that night. I mean, keep you alive, because anything can happen in a fight, and they're there watching, and they have the authorities to stop a fight. So we got to thank the doctors, even like I say, even if we get mad at that night.
And maybe to emphasize, I guess boxing is a sport. It's not supposed to injure people permanently. So it's an athletic event. And so what you've really done is move towards assuring that that's what it is, right, Michael?
Oh, absolutely. When I first started in professional fighting in 1990, 1991, there were very few safeguards. And I spent basically the last 20 years trying to educate the boxing world and implementing regulations to try to protect these kids. And I think over the last 20 years we've made a lot of advancements. We still have a long way to go, however, to protect them.
Now, we heard from Delvin, he started at 9 years old, is that right? Or
That's correct.
Thereabout. Are there more precautions with younger fighters, or younger athletes, I should even say, because the growing brain, is it more susceptible to damage?
Absolutely. The younger the individual, actually the bigger the head size in comparison to the body, and the weaker the neck muscles. And a concussion, which is really any alteration in consciousness, we used to say getting your bell rung, was just getting your bell rung. And we now know that that's a concussion. You don't need to lose consciousness. Is really a function of the brain inside a hard skull. So when somebody gets hit at a young age, the skull is a little bigger than the brain, and as they get whiplash, the skull moves, the brain moves. The skull ultimately stops, but the brain keeps going and can hit the back.
A lot of people don't realize that, as the brain can move a little bit within the skull, and it can actually bang up against the skull and get injured. I'm sure you weren't thinking about this when you were young, but did you ever get your bell rung? Did you ever get a concussion?
Concussion, I did. I had no knowledge of it, but there was time when I really was really out of it. Like there was one time when I fought. I was at the beginning of my professional career, and it's scary. To this day, I still I still think about it, because I got knocked down the first round. I got up and I won the fight, but I didn't realize I was in the fight until I was in the locker room. When I was taking the showers, when I realized, hey, I just finished the fight. Like I won the fight. I went through the whole fight without even being unconscious, really.
And Mike, is that a concussion?
That is a concussion, and you hear that frequently with fighters. They'll say, I don't even remember coming to the venue. What Delvin suffered was a moderate concussion with retrograde amnesia, meaning he knew what he was doing at the time, but afterwards had no recollection of the fight. And there have been many fighters that have told me that, and at that point, it's very important that the brain be given rest.
Well, that's really, now, so how do you know that that's occurred during a fight?
After the fight is over, we examine every single fighter. We do it immediately in the ring. We do it immediately after they leave the ring. And we ask them questions. We speak to them. We look at their movements. We look at how they respond to our questions. And then even after that, we look at them again. If we see things aren't making a lot of sense, we'll do a more comprehensive exam, and we could identify the signs and symptoms of concussion at that point.
What things are you looking for?
When we're speaking to them, are they speaking properly? Are they slurring their words? Are they answering us appropriately? Are they complaining of things like headaches, visual changes? How is their memory? I'll ask them, where are you? And a lot of them will say, I'm here. And I'll say, where's here? And they'll say, well, I'm in the boxing ring. And I'll say, well, what is this place called? And they'll look around and they'll say, a casino. What state? And you start asking questions, and you start to realize that they're not quite right. And at that point, we get them out of the ring if there's been a knockdown, get them in the back, evaluate them, because things could go bad, and when they do, they go bad very quickly.
And what do you mean by that?
Well, in the acute knockout, somebody gets injured in the ring, and they're showing these signs. Sometimes that could be an early indication of mild to moderate brain damage, or even a brain bleed. At that point, it is imperative to get them to the local hospital. And we're prepared for this. We have paramedics, we rehearse, we know where we're going to go, we know how we're going to do it. And the guys I work with at Mohegan and Foxwoods are great, because it's really a snap of a finger. When this happens, I just do a sign and they're there.
Safety is paramount. We have some pictures of you in the ring. I wish we had some of you. You should have brought along some pictures. So why don't you tell us what we're looking at here, Michael? And that's you, the doctor in the ring, isn't it?
That's correct. This fighter was knocked down. I quickly jumped in the ring, and I'm doing my initial evaluation. Mostly it starts with just talking to them, making sure they're conscious, making sure they know what happened, and they're responding appropriately to me.
Next one.
This was actually a fighter who landed face down. And so I'm jumping in, and he had said to me that he had some neck pain, so I'm actually applying ice to the neck. And again, neck injuries are possibilities as well. So at this point, we're starting the evaluation, and I'm making decisions whether or not I want this guy to be able to get up, sit on a stool, get out on his own power, or am I going to get the paramedics in there to take him out on a stretcher with a neck collar. This was also a fight that was stopped. He was actually cut, and I'm calling the referee over, and I'm speaking to the second, which is somebody who takes care of the fighter, and I'm explaining that this injury was too severe to let the fighter continue. This is the initial evaluation after a fight's been stopped. This fighter was not knocked out. He was staggered. The referee jumped in as he should and stopped the fight. We will sit them down. They're not going anywhere until we do our evaluation because, like I explained earlier, things go bad and could go bad very quickly. We're looking at his eye movements here to make sure neurologically he is intact, and this is part of that evaluation. This was a fighter who actually got knocked out of the ring. He was unconscious at this point. My other doctor is stabilizing the neck, and we're again doing that initial evaluation. This fighter was taken out by stretcher. And this is another situation where a fighter is unconscious. I'm looking right now as the paramedics are coming in. My other doctor is attending, the referee is assisting, and in the back an inspector. This is all things that we teach way ahead of time. We give seminars on this. So this guy was evaluated out of the ring within about a minute or a minute and a half. He was taken to the hospital where he was evaluated, and fortunately he was fine. And this is probably my favorite picture. This was a fight that was stopped. The guy was walking to his corner, and all of a sudden the concussion really hit. He lost his balance. He started to pass out. The referee is grabbing him, and as I was going over to evaluate him, I'm trying to obviously grab him as well to prevent the two of them from falling backwards and hurting everybody a little bit more than they were.
So a question maybe with Delvin. How do you feel? Here's a sport where there's really a potential for severe injury. How do you feel about that, and how do you protect yourself from that?
You always keep that in the back of your mind. Like I said before, it's a sport that you can't really say, I'm going to go play boxing. You know, like you can say, I'm going to go play baseball. You can't say that with boxing. Boxing is definitely not a game. It's, like you say, it's very dangerous. And you got to keep that in mind to be able to prepare yourself. And I think the best thing for a fighter to do is every time you step into the ring, make sure you're prepared with your proper training and your proper diets. And I think that makes a big difference because there have been fighters where they're trying to make weight, and the way they do, they dehydrate themselves, and that's very dangerous. It's been proven that it's very dangerous for a fighter. You get hit even one time, and you can just.
And when you're dehydrated, your blood flow isn't adequate. You're likely to faint. It's
correct. So the way I think is that makes me even train harder. Prepare myself that when I step into the ring, I'm 100% ready, physically, which I've done all my proper training.
And Michael, what do you tell fighters to help prevent injury, particularly concussions?
Well, one of the things that we've found, unfortunately, is they're not truthful with us. And a lot of these injuries will occur while sparring. And they may get knocked down, they may get knocked out during sparring. And my belief is a lot of the major injuries and even deaths occur before these guys ever get into the ring in the first place. And unfortunately, when they're preparing for a big HBO or ESPN fight, and there's hundreds of millions of dollars on the line, and it's 2 weeks before the fight, it's very hard to pull out of a fight. And I think that if there was a little more truth coming out of the corners, we could save more lives and prevent more injuries.
Because you're saying if they've been knocked down or had a concussion during sparring, that puts them at a disadvantage then in the ring for a subsequent concussion or major injury.
Absolutely, because the signs of concussions can last for weeks or even months. and a person should not get back to that kind of physical activity until all the signs and symptoms have completely resolved.
And we're going to come back to that in the next segment and talk a little bit more about people who have had concussions, how it should be treated, how it should be handled, from the kids who are playing pee-wee football on all the way up to a professional athlete. So thanks very much. We'll be back after this break.
The first 30 seconds are all I remember. My doctor told me I had cancer. When the shock was over, I met with a cancer specialist at Norwalk Hospital. We weighed all my options: surgery, radiation therapy, chemotherapy, even the latest clinical trials. Their Whittingham Cancer Centre offered me personalised care, hope and leading cancer physicians. And I know great care. Besides being a cancer survivor, I'm also an ICU nurse, and I chose Norwalk Hospital.
Nice. No. Oops. Yeah, sure. Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
Can I have $1?
Yeah, it's right. I think my purse is upstairs on the bed.
It's not here.
Check the dining room.
No.
What about your sister's room?
It's not there either.
The upstairs closet? The downstairs closet?
There are no more closets.
Moms everywhere are finding ways to keep kids active and healthy. Get ideas, get involved, get going at letsmove.gov.
Welcome back to Health Talk. I'm Dr. Eric Mazer. I'm back with Dr. Michael Schwartz and Delvin Rodriguez. Delvin is the international and USBA international light middleweight champion. And again, I'm so glad to have you both on the show. Delvin, I learned during the break that you also speak to kids in the area and kids in schools. What message are you delivering them?
Well, basically, it's, as an athlete, you got to have the discipline, hard work, and really be committed to what you're doing. Also, you got to stay healthy, which is, stay away from the drugs, liquor, and stuff like that. And as an athlete, it's something that you have to do to be able to accomplish, your goal. My goal is to become a world champion, and to be able to do that is the hard work, is the discipline, and also keeping myself very clean, which is not just when I go to camp or when I'm training. Stay away from the bad stuff, which is the drugs and stuff like that. Always, you got to walk around as an athlete, which is, like I say, stay clean and very healthy, and that's the way to do it.
Michael, any thoughts?
Oh, I agree. Too many careers have been cut short, whether it's in baseball, football, boxing.
The arts. I mean, we've heard of these famous people, wonderful, Whitney Houston recently, just terrible.
Absolutely. The drugs and the alcohol, really hurt the body, and it increases the risk for injuries.
Now, we've said a lot about concussions. Maybe we should get back to very basics. What is a concussion? I think people have a vague notion that it has something to do with your head getting hit, but what is it? When do you, as a doctor, define or say that a concussion has occurred? And what do we mean by that?
Sure. A concussion is any time the brain is injured and it alters the way the brain works. And what does that mean? If the brain gets hit, whether it's from an impact, such as in football, or whether it's a high-speed impact, such as for example, a motor vehicle accident, the head could be thrown forward, and again, the brain sits on a stalk surrounded by fluid, and it could hit the side of the skull. And if the tissue is damaged, signals are sent through the brain saying, I'm not happy right now. And that could result in immediate symptoms such as altered consciousness, dizziness, problems seeing, problems thinking, problems talking, cognitive movement disorders. We see that often in all sports, not just boxing. And those are very serious injuries because if they're not addressed very quickly, they could lead to more permanent damage or even death.
So what should we be doing as physicians, as concerned citizens, to make sure that our young athletes and our professional athletes are not injured by their profession or by their avocation?
Well, there's actually a state law in Connecticut which forces trainers or coaches to take a class in how to recognize concussions. So for example, if somebody is hit on the football field and suffers what looks like a concussion, they have to be taken out of the game. They cannot,
for the whole game?
For the whole game. They cannot be put back into that activity, into that game. Not only that, they need to then go to their doctor to get a formal evaluation to be certified to return to activity. And that's a complicated kind of thing to evaluate when a concussion has resolved.
So that's apropos of what you were saying earlier. If someone's had a concussion during training, getting ready for a fight, that's a dangerous proposition to then go back into the ring, in a short period of time thereafter.
Sure. The most important thing to do after concussion is rest. The brain needs rest. You should not be watching TV, texting, reading books. You should be just relaxing. If you relax, the brain is really wonderful at healing itself. If you go back into activities too quickly, this could lead to chronic injuries, and we've seen things happen 20, 30, or 40 years down the line and resulting in permanent brain
damage. And I want to
damage.
get to that at some point because I think we all know the most famous boxer of all time, Muhammad Ali, and what has happened to him. But Delvin, it must be awfully hard for a boxer, a professional athlete, to be told to rest. I mean, how do you deal with that?
Definitely, like Michael was saying, especially when you're getting ready for a fight, and they're telling you got to pull out the fight when you just have the TV waiting for you, when you got the money there. It's very tough. It takes a lot away from a fighter because you pretty much have to go back, you said, rest, and then come back again, start your training all over again. So it's a tough situation. And like Michael said, I agree with him definitely when he said most fighters, they get hurt while they're training.
Michael, how do you deal? What rules do you think we should have in place to further reduce the risk for professional boxers, particularly on, you just mentioned, the immense pressure to go on with the fight?
Well, I think if the trainers, and a lot of trainers do care for their fighters, so this is not a universal issue. A lot of trainers will pull their fighters out of fights when they recognize there's an injury. Most of the time it's obvious things. They've hurt their hand, they've hurt their shoulder. The brain is a much harder organ to evaluate. You can't CAT scan or MRI a brain and see a concussion. And that's the biggest problem. So if the trainer really cares about their fighters, they're going to say, you know what, I'm not letting you get in there because you're not ready.
Now, Michael, sometimes a head injury or concussion may be the first symptom of a more serious bleed. So when should athletes be imaged? In other words, have an MRI or a CAT scan after a head injury? Where do you draw the line?
Well, I think any loss of consciousness or symptoms that are increasing, you should have an immediate CAT scan because that's going to show a bleed. And the bleed is probably the most significant initial finding that you could have because people could die from bleeds.
And let's talk a little bit, concussions are in the news now with NFL players. How should we be handling repeated head trauma? So it's the professional, I look at Delvin, the professional boxer, the professional football player, even the younger football players and boxers who are getting repeated head trauma. What's your formula for that? Is it one concussion and they're out of the sport? Or you said resting, how long do they have to rest? How can we eliminate the risk of long-term damage?
Well, there's no magic bullet in this. There is something called neuropsych testing. And neuropsych testing basically is a way to get a baseline of your cognitive abilities, your reasoning, your memory, your ability to do things. And they do it, especially with the young kids. It's an excellent test. It gives us a baseline of where they are before they start their career.
Then let me just ask, are you recommending that for all boxers? And Delvin, have you ever had neuropsych testing? Has this ever been part of your?
Not that I recall.
So it's not. So go ahead. Is this part? So this isn't part of.
This is not part of it. And unfortunately, without a national commission in boxing, every state can do basically whatever they want. But this should be universal. This should be at the elementary school levels, at the high school levels, because if you're concerned about a concussion, you repeat the test and you see how the kid scores. And it is amazing that the kid may have very few symptoms and score so much lower on the neuropsych testing compared to the baseline.
Would you object to this as an athlete?
Not at all. Not at all. I'm up for all that. I'm up for whatever makes best for and safe for all the athlete. So I definitely agree with that. I'm always open for all kinds of stuff that's going to help us.
Let me ask you, because again, it's unusual for us to have a world champion, anything here on the show. But here, so much of what you do is here and now, and you're a very young man, and yet you've got a long life ahead of you and a long life beyond boxing that you have to live with. Are you able to focus on that at all, your long-term life, or does the immediacy of your boxing, does that overwhelm you at this point?
Well,
that's sort of a dumb question, but it's hard to ask that.
No, but it's a good question because yes, you have to think beyond boxing because the body is not made to get hit. The body is going to come a time where my body can't take it anymore, and I don't want to take it anymore. It's a very tough sport, so you definitely have something. You got to have something to fall back on, something to do. And thanks. I've been given a good opportunity, and I'm working with the ESPN as a analyst, as a boxing analyst. So believe it or not, it's a good question. You got to have something to fall back on. And like I said, I've been given the opportunity to work for the ESPN.
So that sounds like good advice for professional athletes, for all athletes, not to depend solely on their athleticism, because you can lose that with an injury, or you can lose that just simply by getting aged.
Oh, definitely. It's like I say, the body is just not made for that. I mean, and you can't just do it forever. You can't. There comes a time where your body, you don't want to get up anymore. You don't want to do your running anymore. You don't want to go to the gym.
That's the way I feel every morning when I get.
So you definitely got to have something to back you up.
So let's take it back to the parents at home, Michael. And what should they be doing for their kids? What should we be doing for our young athletes to protect them against repeated concussions or any concussions?
Once your son or daughter suffers a concussion, the biggest problem seems to be the parents, actually, because they want their kid in there. They feel if the kid's not in there, they're going to lose their starting job. But if your kid suffers a concussion, it's imperative that you take the kid out of the game, that you let the kid rest, and that you don't let your son or daughter get back into the activity until all the symptoms have resolved and has been evaluated by their pediatrician or family doctor. That's the most
how long
important.
rest are we talking about? Days, weeks, a month?
It could be days, weeks, months, or longer. And sometimes with repeated concussions, we've shown that down the road, this has led to chronic damage starting as early as 17.
Wow.
And if you let the kid have repeated concussions, that might be fine for today, but you're doing them a disservice when they're going to be in their 30s, 40s, and 50s.
So at some point you don't get healing, but you get further deterioration of the brain.
That's right. There's a study, Chris Nowinski's, who was a WWE wrestler, actually started the Sports Legacy Institute, and they do autopsies on the brains of injured athletes who have died from head injuries. And they're finding very alarming findings, specific proteins that are found that should not be found till you're in your 70s and 80s in people who are as young as 17, but specifically in their 20s and 30s that have taken the lives of these young athletes.
So the word punch drunk is very real. That term, punch drunk, really represents somebody with permanent brain damage.
We have more and more fighters fighting into their 40s and even 50s, and statistically the brain starts to shrink after the age of 40. So if we talked about earlier how the brain sits in a cavity, and the smaller it is in that cavity, the more room there is to kind of get swashed around.
We've got about 10 or 15 seconds left. I want Delvin to have the last word. What do you have to say to the children out there and the parents out there?
Well, I think it's very important to, like I said, keep yourself clean, keep yourself healthy, which is staying staying away from junk, of course, and if you're gonna be an athlete, live as an athlete. Do your proper diet, your proper training, and your proper rest. I mean, rest is as even more important than just your training.
And I'll just say thank you for coming on the show, Michael. Thank you. The doctors are your friends too. We're here to help protect you guys.
Definitely.
So you can get old like me and still be healthy. So if you have a question at home you'd like to ask on Health Talk, please contact us at healthtalk@norhealth.org. I want to thank Dr. Michael Schwartz and Delvin Rodriguez for joining the show today. Very, very interesting. I'm Dr. Eric Mazer. I'll see you next week with Andrea Peterson on Health Talk. Bye-bye.